Welcome to the next issue of JASN Podcast. I'm Josie Briggs, Editor-in-Chief of the Journal, and we're delighted to welcome our listeners to introduction of the January issue. The January issue will be in your mailboxes soon, and we have selected 6 superb papers to highlight from this issue. The first is entitled Deep Learning Algorithms for Animal Pathology. The author is Dr. Boutelja and co-authors. And this is a study which undertakes analyses of kidney pathology to provide outcome-related data in animal model studies that are essential to understand disease pathophysiology. The authors use a deep learning technique, the convolutional neural network, as a multi-class histology segmentation tool to evaluate kidney disease in animal models. This enables rapid automated segmentation of digital whole-slide images of PAS-stained kidney tissues, allowing high throughput analyses in multiple disease models. The network also performed well in evaluating patient biopsy samples. This work bridges clinical and preclinical research. It extracts quantitative morphological features which are closely correlated with the standard morphometry measurements. These findings indicate that deep learning-based segmentation in experimental renal pathology is a promising step that will help reproducible, unbiased, high-throughput, quantitative digital pathology of the kidney. The next paper we chose to highlight is a humanized mouse model of C3 glomerulopathy. The authors are Devalaraja, Narasimha, and co-authors. The paper takes off with the recognition that animal models are valuable to explore factors that modulate progression of C3 glomerulopathy, which is characterized by alternate pathway activation. But no good animal model has been available. What the authors did is they replaced the mouse C3 gene with the human equivalent, and the humanized C3 mice rapidly mimicked the pathologic features of C3 gene in patients. This study allows genetic and pharmacologic dissection of critical contributors to complement-driven renal pathology. The fourth paper we selected for highlight is on adiposity and CKD. Although diabetes and high blood pressure explain half of the association that conventional epidemiology has found between increased body mass index and higher risk of CKD, residual confounding features make it difficult to make any causal inferences. A genetic approach, Mendelian randomization, overcomes some of these limitations. Analyses of almost 300,000 genotyped individuals suggest that the belief that there may be a genetic causal link is probably overstated. In fact, this approach suggests that blood pressure and diabetes are important mediators of the association between adiposity and CKD. The author of this paper is Zhu and team. The next paper, as you will not be surprised, is part of an ongoing emphasis on bringing our readers important work on COVID. This study examines AKI and renal replacement in COVID-19. It's the largest of the COVID-19 renal AKI studies we published. It's a study of 3,099 adults with COVID-19 admitted to intensive care units in the U.S. And it found that AKI requiring renal replacement therapy is reasonably common among the critically ill patients with COVID-19 and is associated with high mortality. A figure from this paper is featured on our cover, and it illustrates some of the patient and hospital level risk factors associated with the need for renal replacement therapy. This study is by Gupta and co-authors, and there's an editorial by Walt and Bogshop on this study. Next paper we chose to emphasize is on phosphate removal during dialysis. It is known that phosphate is removed during hemodialysis, but the origin, cellular or extracellular, has been uncertain. The authors used phosphorus magnetic resonance spectroscopy to quantify the component of intracellular inorganic phosphate, also creatine, and the ATP kinetics in 11 patients during a 4-hour hemodialysis treatment. They confirmed that phosphate is at least partially released by the intracellular compartment. This raises the possibility that excessive dialytic removal of phosphate may adversely affect the intracellular availability of high-energy phosphates and therefore cellular metabolism. Important new understanding. Author of this study is Chazo and co-authors. And the final paper we're emphasizing in our highlights today is on lifestyle factors in CKD. It is a systematic review and meta-analysis. Though it's known that CKD incidence is increasing, there are not actually evidence-based lifestyle recommendations for CKD prevention. So these authors undertook a systematic review of 104 observational studies of about 2.5 million participants. And they found consistency of evidence for a number of measures for preventing CKD onset, including increased dietary intake of vegetables and potassium, increased physical activity, moderating alcohol consumption, lowering sodium intake, and stopping tobacco smoking. In the absence of clinical trial evidence, these findings may help physicians and patients in discussions about lifestyle measures to prevent CKD. Author of this paper are Kelly and co-authors. So those are highlights. I think you'll find much of interest in the January issue, and we hope you enjoy reading it. Thank you for your attention.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.